30% of infertility is female related, 30% is male related, and then basically the rest of it is either a combination of male and female, or we're really not sure in that case of that person or that couple. Number one myth is it's only egg quality that contributes to a healthy baby. Absolutely not. We hear that a lot. Couples in general look at the woman a lot, including the woman herself, thinks, oh, it's my fault that we're not getting pregnant. But actually, it could be. 30% of infertility is female related, 30% is male related, and then basically the rest of it is either a combination of male and female, or we're really not sure in that case of that person or that couple. So yes, sperm, that is very, very important. That myth, Nixnay, egg quality is not the only problem or contribution to fertility. Sperm, egg, and sperm. Myth number 2 is if I have PCOS, I cannot get pregnant. That's definitely not true either. We see many women who have PCOS are having trouble getting pregnant. We work on balancing the hormones and they're pregnant. So if somebody has PCOS, absolutely, pregnancy is a very good possibility if the hormones are balanced. All right, number 3 myth is that if I have PCOS and take birth control pills, it'll balance my hormones and I can get pregnant. Well, no. If a person has PCOS and takes birth control pills, the birth control pills are helping regulate the cycle, yes, in that progesterone is being placed in the system and then withdrawn, so to speak. So you're taking progesterone for a few days, and then once you stop, there's what we call a withdrawal bleed. And so that's not a normal bleed. Patient's not going to be ovulating while taking birth control. Obviously, that's why it's birth control to prevent an egg being able to be fertilized by a sperm for birth control. So if anything, taking birth control is actually disrupting the normal hormone balance. Myth number 4, I'm on birth control, no problem. I'll stop it when I want to have a baby, and I'll have no problem getting pregnant. Well, sometimes yes, but sometimes no. There are some women that can be on birth control for a while and don't have a problem getting pregnant. But then there are quite a few other women who we do see struggle to get pregnant after being on birth control. And when we're on birth control, it shuts down our normal communication between our brain and our ovaries. So there's not that signal for the ovaries to produce the hormones and to have the estrogen that we need at the beginning of our cycle, and the estrogen surge to trigger the LH and the FSH and the progesterone to finish out our cycle. So when we don't have a normal hormonal cycle, then a lot of times we don't ovulate and we're not able to get pregnant. In that aspect, yes, we do need to work with patients who have been on birth control in the past and help regulate their cycle in order for them to get pregnant. And myth number 5, I can do whatever I want in my teens, 20s, 30s, and still get pregnant. Well, sometimes it happens that way, but many times it doesn't. And we find that depending on the person and depending on what the lifestyle component might be, that the longer the negative aspect of the lifestyle has been in place, the longer it takes usually to reverse the changes that have been made from, for example, drinking excess alcohol continuously for many years. That's going to take almost that many of years that it's been happening to reverse those changes that we find for many couples. We say looking at things sooner rather than later is fantastic, because if we can be optimized or close to optimized prior to even wanting to get pregnant, then it's going to make that journey a whole lot easier. And many people might not be at that point in their life. And I understand. I was a lot later in life as well when I met my husband, and we decided we wanted to try for a natural biological baby. And So you do, what you can do at that point in your life, and any lifestyle changes to the better, to positive fertility, is fantastic. So you keep it up and you start wherever you are.
If you'd like to learn more, please like and subscribe to my channel.